Thank you, Dr. Witzel, and all the panelists for those terrific presentations and really thoughtful discussion. Next, I'll turn things over to Dr. Allison Karpyn, who's a professor at the University of Delaware and the co-director of the Center for Research in Education and Social Policy. Dr. Karpyn will be moderating an expert discussion, really building on the conversations we've had this afternoon and reflecting on the future of PSE intervention methods. Dr. Karpyn.
Hi, everybody. It's great to be here, and it's what a dynamic set of conversations we've had. I think it's fascinating to think about, and I look forward to hearing your views, Dr. Dietz and Dr. Economos, on some of the topics we've had today. I'll just briefly introduce. I know that there's full introductions available in the materials for today's session, but Bill Dietz is at the University of Washington. George Washington University, Milken Institute School of Public Health, and Dr. Economos is at Tufts University, Friedman School of Nutrition Science and Policy. So thank you all for joining us. My first question is, I think a little bit of a reflection on what we've been hearing. We sort of started off today, or at least this session, talking about PSE as a complex community initiative. And then we've gone on to really look at some data collection strategies that really I think a bit differently about the types of initiatives, really having expanded already to much more large-scale policies. So as we go through these sort of conversations about methodologies, I just sort of put that in the foreground as context. I'm going to start, though, with this idea that PSE is a complex community initiative, where we really heard a lot about the importance of studying the systems changes and working with community before we focus specifically on health outcomes. So I'm wondering what practical or methodological issues kind of stand out to you all in these conversations as we try to push toward rigor. Do you want to start? Yeah.
Sure. Well, thanks for that question. But before I really begin to turn to that, I wanted to say what a phenomenal day this has been.
Yeah.
And the presentations have been extraordinary and thoughtful and insightful. I'm really humbled to be asked my opinion because the kind of expertise that you heard is not shared. I don't share that. That's not my background. So my thoughts are perhaps naive, but anything but erudite. But I'm so glad to be here and so glad to have had that experience. So to speak directly to your question, my takeaway is that we need participatory community engagement as a PCE to join with the PSE. That the community engagement is essential, as we've heard in so many of these presentations. And particularly, it ties back to Aaron's first presentation on the power of systems as a way of beginning to address these wicked and complex problems. I think we heard something about this, about the importance of this in Dr. Greer's presentation, in which she pointed out the importance of community engagement prior to the development of the grant, which is obviously hard to do, but it reminded me of that important perspective of nothing about us without us as the mantra. So I think one of the challenges for funders like NIH is how do you assure that there's authentic community engagement as one of the underpinnings of whatever community-based initiative is underway. And I'll share with you, I think now may be the appropriate time to share with you some of the other takeaways that I've had. I was really struck by Dr. Salen's emphasis on trust and humility. You don't see that very much in bench researchers, at least the ones that I know. But that importance of trust and humility and honesty is really a critical element if you're building the community underpinnings or the kind of relationships that are going to be necessary to complete these studies. Dr. Medina's Head Start experience reminded me of another experience, which I'll share in a minute, but it was unusual because it tried to work within an existing structure. And it wasn't until she went beyond that, because she didn't see any significant changes when she worked within the Head Start system. But when she began to expand to the family environments outside of Head Start, there weren't necessarily significant changes, but they were more positive. And it reminded me of these two major interventions around the prevention of obesity in low-income children, and the known as GEMS and Copter. Massive interventions, expensive interventions, highly controlled, and with incredible retention around family intervention, skill building, innovative approaches, big retention rates of 75 to 95% 2-year to 3-year retention. And all of these programs met the U.S. Preventive Services Task Force recommended hours, 26 hours per year. And none of these, and there were 6 of these sites, found a significant shift in BMI trajectories compared to the controls. And I think this was a good illustration that builds off of Dr. Paramedina's observations, because it was the community context, which I think the researchers failed to address, but which accounted for the lack of positive findings. So there were high rates of food insecurity, 30 to 50% of all families in Copter. In Cleveland, several children were friends of Tamir Rice, the boy who was shot by the police. And one participant in the study was shot in a drive-by shooting. And in Cleveland, 10% of families changed residencies greater than 3 times, and 30% changed schools annually. And in Oakland, center leadership or violent crimes prompted 6 site changes and lost transportation services early on. And in Minneapolis, families moved in and out of various intervention components, suggesting that the fluidity of these changes and these which were not considered, were really pivotal in terms of the lack of impact, because I think that it's hard to prioritize obesity in a context where these massive community concerns are distracting and really become priorities for families. But the final point I would make about this morning and this afternoon was I'm so pleased to see this next generation of investigators, which is really impressive. I mean, Chris and Shariki and I have been around for a long enough time to recognize that this new core of investigators is essential. And for me, it brings up the importance of training of the next generation below this generation necessary to achieve the kind of successes that we want to see.
Thank you. That was a great reflection. How do you follow that, Chris?
Well, thanks, Bill and Allison. Thanks for the question. Really great to be here. I agree with Bill. Phenomenal presentations. Love the complexity of thinking and the depth and thoughtfulness that we heard today about how people are approaching their work. And I'll offer a couple reflections to respond to your question. And I look forward to more. But one thing I noticed and I know is helpful is designing the work in phases and really ensuring that we have valid and feasible PSE measures. And we're thinking about the selection, the testing, and the time and place before we assume any outcomes at the individual level will occur. We all know it takes time for PSE changes to take root and to really shift the conditions around an individual to see these downstream outcomes. And this also speaks to the need for multi-year studies. These do not happen overnight. This was emphasized by many people. And the other point was a mix of qualitative and quantitative, because we need to understand if things happened and to fully understand why things happened. I also want to talk about updating our mental model of what systems changes are. Amy specifically mentioned systems level outcomes like referral system improvements and co-location of services. These are system changes that we hadn't traditionally thought about when we approached obesity prevention with the PSE model that we've all been using. And Angela even showed that there's a variety of PSA you can think about talking to families and using the Getting to Equity framework. And I thought it was beautiful the way she showed how the Getting to Equity framework identified these PSE changes and crossed over the different quadrants in the model. So really expanding our thinking around what is a system and how do we think about the nuances within different systems. And the last thing I'll say is we need to go even further and think about system dynamics. So it's not just a stagnant variable that we need to look at and measure how that is at a point in time and then another point in time, but more importantly, how things are operating together in this complex world. And many people talked about now studying systems, complex systems, modeling, and I think that really has uncovered a lot for many of us. And I'll just cite a couple of systems that we've been able to identify in the work, and they include, intergenerational wealth or intergenerational poverty. This isn't stagnant. This is something that happens over a long period by many variables that contribute, or time trade-offs, and that can shift depending on the stage a family is at and the conditions that they're living in. Or lastly, trauma. And that's seeded early, but the impact and the outcomes can be over the long term, and they can also be passed down. So these are dynamics that are at play in a community, and we call them system dynamics. And I think those are important to think about and to measure as we move this PSE work along. Thank you.
Yeah, I really like that idea about system dynamics. And it makes me think that of this idea, right, of having to understand the health of a system before you can really even understand the outcome of that system on health. And also the health of the policy or the health of the system change. Then you've got the health of this larger dynamic of community, and then actually these individuals who we've been measuring, which I think does bring up some interesting questions that we've seen. I think some, again, wonderful presentations which speak to outcome measurement. I think Brian brought up some good points about scale, and you do a study with a much smaller sample or more specific example, then your opportunity for variability in results and potentially a null or negative finding might even be greater than when you have opportunities for much larger data. So I'm just wondering what you all think about sort of this issue of collecting primary data where we might be more constrained to smaller sample sizes because of the logistics of that versus these secondary data sets, which I feel like are growing before our eyes with technology. So, and industry partnership too.
Well, I think one of the challenges with secondary data is that you really don't know necessarily the quality of the data that have been collected. Whereas if you're using if it's your own sample, then I think you're closer to understanding what the limitations of those data are. I do think that the secondary data are really useful because of the numbers that are generated. And I think it was Brian's presentation which emphasized that, when you have 5 billion kind of data points, that may overwhelm the potential inaccuracy of those data with just the raw numbers. The other thing that I think is, it was a thread that wasn't really emphasized throughout the day, is although it was mentioned several times, is that the repeated use of group-based model building and causal loop diagrams, and there was at least only one that I heard on social network analyses, and those are perhaps more qualitative but more insightful. If you do sequential social network analyses, looking at, and I think if I'm not mistaken, you did one of these in Somerville, didn't you? Yeah. to look at how those shifted over time as a measure of community change. And that's not really a quantitative model. It's not primary, or well, I guess it is primary data, but it provides insight that I think these broad data sets would not provide you with.
Yeah, just to build on that a little bit, I think getting the technology up to speed to do that even better. You know, the form of social network data collection that many of us have used is, it is using technology, but it's still not evolved the way it should be, meaning to get a very large sample and to crowdsource and to make sure your sampling is appropriate takes a little more effort and time. And I think that's a direction we need to move into. And I agree that, you know, secondary data and these large data sets, as Brian did an excellent job showing us, are really, really valuable, especially if we can then stratify to look at different subpopulations within these large data sets. When you're collecting at a primary level, sometimes it's a bit more narrow, and you end up with a homogeneous sample that doesn't tell you as much about the variability within a population. So it's definitely a benefit. A couple of comments on the primary data collection, despite the fact that it's often small, we can really measure the right thing. So sometimes you are relying, as Bill said, in these secondary data sets on someone else's decision-making. Sometimes it works, but sometimes to really match with the intervention, you need to rely on your own data collection and not someone else's decision. We also really need implementation factors, and this came out multiple times today, for adoption and modification of the strategy, differential uptake, addressing issues of equity. And then the other thing I'll say about primary is it builds capacity with community members. If they're involved in helping collect it and actually interpreting it and then publishing it, it's really great because they're understanding a lot more why we collect data and the meaning of the data. So I would say that's a real benefit of primary when you're able to do it and you have the resources. We use things like impact and feasibility assessment to decide, you know, what to measure and when to measure, because when you're doing primary, you can't do it all.
Mhm.
One
I
of the,
really- oh yeah, go ahead, Bill.
well, this is a departure, so why don't you go ahead, Allison, because I'll make this point right after you.
Well, I was just going to say that I just was going to reflect on this idea that secondary data, while, you know, inherently attractive given its volume and potential availability, can also be, you know, a square peg in a round hole if the intervention is not necessarily intended to, you know, touch that perspective. So anyway, go ahead, Bill.
Another thing that I didn't hear very much about, and I worry about, particularly with some of with one presidential candidate, and that's the so what factor. So we've got great positive findings in many of these studies, but who takes these to the next level? How do those observations actually get translated into policy, and who does that? I thought the presentation in Minneapolis was nice because, I mean, there was a framework already of a policy that was ready to support the intervention that was eventually implemented. But that's an exception, I think. And who is it that takes this forward, and how is it taken forward? And because it doesn't help us very much if we've got really great research results that are not being translated into policy, and that's a whole nother arena. And I wonder about the extent to which we're training people in how to begin to think about policy and interact with policymakers, because they're a completely different breed, as we all know.
Yeah, especially coming off of Lori Witzel's discussion, doesn't she know? And I feel like I would be remiss if I didn't offer my deep regard and respect for my recently passed colleague and friend, John Weidman, who passed and worked so hard on so many of these issues, and we will definitely miss him deeply in this field. With that, I want to talk a little bit about sustaining interventions. I think policy is one way that we.
Uh-oh. Okay. All right. we can move onward, Bill, until
Right.
Allison comes back. I think she wanted to ask about sustaining probably change that happens. That's my guess, but we could, is it okay if I just make a,
I don't know
oh,
where
there
I
she is.
she suddenly
Okay.
promoted me to a panelist. Maybe they didn't like me reflecting on my friend. I don't know. Okay, so I was going to talk about sustaining PSE interventions because I think that one goal, right, is that we test these interventions and hopefully we're able to turn them into policy or take them to scale. How do you think this idea of getting to scale and strategies to sort of study things once they get there, or push toward scalability? You know, what are your current thoughts, I guess, on this idea, and where does it belong in this research process, especially when it comes to measurement, which, you know, is the topic of today?
Well, I think soda taxes are a good example because we know that where they've been implemented, there's an effect on consumption, but spreading that intervention is really challenging, and there's a huge pushback from the industry, which doesn't go away even though the policy has been implemented. So I think that not just getting the policy passed is, I mean, that's certainly essential, but defending that policy as it goes on is equally important. And I think it's been the industry pushback that has really limited the spread of that intervention, even though the Choices Project showed that was really one of the most cost-effective interventions that we could have again around childhood obesity.
Yeah, I was going to actually mention Choices as well, Bill, as you know, we have a suite of interventions that have been shown to be cost-effective and would really benefit all. And I think getting those implemented at the national level is challenging, given the pushback, given the funding, but there's no question that we have to advance some of those that have strong evidence and will have a return on the investment. And then at the smaller P level, when you get down to the local level, you know, it has to align with community needs and readiness and priorities, and that's where the impact and feasibility exercise is really helpful. It still has to have an evidence base that supports it. So doing the type of work we heard about today and generating the evidence base is really key, and then aligning it with a specific context is very important. The other thing I want to emphasize, it comes back to a previous point, is, you know, who's getting trained, and Bill mentioned a new group of investigators, which is fantastic. And a lot of us who are speaking today are R1 universities. And that's where a lot of the funding goes, which is understandable. There's an infrastructure. How do we bring other people across the country who are in communities with disadvantage, where there's a lot of need, to do this work with us and to make the kind of impact that we need? And I think that's something we need to think about with respect to training and the structure of the academy overall, and who does the funding go to, and what are the pathways that we can create so there can be more equitable participation in the research process, which then helps with the translation at the local and even state level.
Mm-hmm.
To build on that, one of the other things that we heard right at the beginning from Heidi is the necessity to reframe this whole issue about obesity. And my candidate for that would be to focus on human and planetary health. And when we think about that, the combined strategies around each of those has a positive benefit. So that, for example, think about procurement policy, and that can be shaped to purchase healthy items that would benefit both the health of people and the health of the planet. And there's a large group that we've been working with on the Federal Good Food Purchasing Coalition that's been pushing for just that. And in fact, we were trying to get a federal policy through HHS to declare or to use value-based purchasing for their products. Federal government is one of the biggest employers, and changing what's available in their cafeterias would have a positive benefit on human health. But also, if it's aligned with planetary health, you have a win-win situation. And the same is true for the physical activity sector and public transport and reducing greenhouse gases. So, and the model that that many of you know that we really think is important is the whole model of syndemics, these interacting kind of pandemics. And in this case, I think that the syndemics of racism, income, housing, and access to food is a combination that needs to be taken apart through the kinds of social dynamic modeling that we've heard about, and I think would be a really powerful tool to apply to these multiple elements of the syndemic, particularly if it's organized around planetary and human health.
I agree.
Yeah, Chris, do you have any additional thoughts on this idea that we have so many of these interconnected issues, right? I think we talked about the social determinants going back many, many years now, and more we're seeing communities. I think maybe even Tamara brought it up in one of her questions early on about sometimes violence is just what's taking precedence. And we've got housing instability. We've got these complex interwoven issues, and we know that that's the environment that we're working in. Do you have any other thoughts on what we should keep in mind when it comes to designing evaluations in these really complex environments?
Yeah, and Bill talked about it at the beginning. You can design the best intervention and implement it in a community or in a geography where so many of the structural barriers will prevent the intervention from taking root and the dose being delivered where you'll see any outcome. So we can't do that without understanding context and surfacing what the interconnected structural barriers are. And that's why interdisciplinary work is so important. And I heard a lot of that today, people working together from different disciplines. The Compass work that's being funded is trying to get at that, you know, training our future leaders to really think in an interdisciplinary way, stay rooted in your discipline, but work with others and try to approach a problem in a different way. And I think it starts to feel overwhelming. And the other thing I would say is pacing it. So, you know, mapping out how you could work in a particular area on a particular topic and trying to pace it so that you have some results so you can keep going. It's really hard to tackle it all at once, but the deeper leverage points, the root causes, if they're not addressed, it's very difficult to change diet, physical activity, and the other behaviors that we know ultimately impact weight status and body size.
Yeah, I mean, if you're scared for your life, eating an apple or eating a bag of chips just doesn't seem to matter, does it?
Yeah, and just to be clear, when I said that, I meant linked to health, right? Because what I really care about, what we all care about, is health, and obviously body composition is a predictor, but that's the ultimate outcome that we're looking for, is health and happiness.
Yeah. Mental health is obviously a big one too. That's really underlined a lot of our conversations today. And I think especially after the COVID pandemic, we really have had a resurgence of understanding of the importance of mental health, especially among our teens and social media. What do you think about the interaction between mental health, or studies that focus on this idea of well-being and mental health as an important mechanism for obesity prevention? Is there a role for that in rigorous research in this area? Or are we, do we need to stay focused in other ways?
Absolutely, we need to focus on mental health. I was thinking that in many of these environments, things that we wouldn't necessarily think have an impact on mental health will absolutely do so, like housing, for example, which is a major concern, and that having stable housing may relieve the anxiety of foreclosure and enable people to lead a more balanced life because they're not anxious or losing sleep, all these other, or smoking more because of the anxiety they have about the stability of their housing. And that may have as a huge as benefit as anything else that we talked about today.
Mm-hmm.
Yeah, and I agree with that, especially early exposure to some of these toxic elements in an environment and trauma, is just setting a pattern with neural development really early with children and paying attention to that. There have been some studies that have really approached it more holistically with incorporating, meditation and other stress reducing techniques and things to buffer, some of the exposure that children face. And they're really important because they're lifelong skills toward building some resiliency. You can't always stop what's around you, but you can control some things about the way you're responding to it. And not to say we shouldn't try to change an environment to make it healthier, but there's also some of those techniques that can be helpful as well. And we don't pay attention to those in school as much. They're not prioritized.
Mm-hmm. Mm-hmm. Well, we only have a couple more minutes left. I'm just thinking, as you all look ahead and obviously process a lot of the really rich conversation that we've had today, what excites you? Where do you see, where do you want to kind of put an exclamation point on something that you've heard or a lesson that you've learned in your own research?
Well, I thought I was impressed by Angela's presentation because it's the first time I've seen an expansion of Shariki's framework. And what I'd like to see is what, as she alluded to, what the next phase of that research is. But how do you prioritize within those interacting factors, and what kind of intervention should be prioritized or likely to have the biggest impact? But that's the first, and I think maybe there are others that I just haven't seen, the first example of how to build out of the framework some specific strategies in each of the 4 quadrants that could have an impact. The other thing that's quite clear is that one-offs are not going to work, and I think we've learned that, and that was an unspoken theme today, but one which I think applies to her work, that the multiple kinds of opportunities afforded by her analyses, I think would translate nicely into policy interventions.
Mm-hmm.
Yeah, I couldn't agree more. The Getting to Equity framework coming alive like we saw today was really exciting. And just those 3 words are so important. And I did hear that ring through a lot of the presentations today, that's where we're headed. And there's really, I think, an embrace of that throughout our field and by many people across the country. And that means training people appropriately. We also have to harmonize big data sets if we're going to use more secondary data. And there's a lot of hope there. We have to figure out how to do that better so we can really learn from different geographies and different fields that collect data. And as we're talking about, it has to be interdisciplinary. And then I think, there's finally an embracing of multi-level, multi-sector interventions. They're hard to do, they're hard to analyze, but we can't have one-offs and we can't have single sector or individual interventions. They are overwhelmed by the environment we're in and they don't provide the dose that's needed to get to good health.
Well, thank you all. We're at time. I really appreciate this conversation today. It was
Thank you so much.
Well.
Yeah,
Thank
thanks.
you.
Really nice to be here. Thanks.
Yeah, likewise.
Dan, back to you.
Great. Thank you so much, Drs. Karpyn, Dietz, and Economos. That was a really incredible conversation that so nicely distilled out some key takeaways from today's workshop and some of the implications for where the field needs to go next. So we really appreciated that. To close out the day, I'm going to hand things off to Dr. David Berrigan. Dr. Berrigan is a program director in the Division of Cancer Control and Population Sciences at the National Cancer Institute. And in that role, Dr. Berrigan supports a portfolio of grants, contracts, and research activities concerning energy balance and cancer control, with a focus on built environment, evaluation of natural experiments, physical activity, and alcohol. Dr. Berrigan is a very active NCORE member and also has served on the planning committee of the Opus Workshop Series, so is in a great position to close us out today. Dr. Berrigan.
Thanks very much, Dan. And probably, I shouldn't have been allowed to make any remarks. We should have just heard more from Chris, Bill, and Allison, who were doing a beautiful job of summarizing today's conversation and future directions. But nevertheless, so I'm not going to go on and on, hopefully, but first of all, it seems, so important to be addressing the next steps in childhood obesity, but it's also a really complicated problem right now because we're in a fast evolving landscape of changes in pharmacological environment, changes in people's time use and lives associated with the pandemic and its aftermath, a dramatic increase in our focus on equity, finally, and this intense conversation around whether obesity is an appropriate outcome and stigma about obesity. So it's a complicated time. And that, is a subtext, I think, of everything we've been talking about today. Next slide. I was, I'm not going to rehash the sessions and talks and things, but I want to give a huge thank you to the speakers and the moderators and for really bringing their A game. And, this was a very high level of presentation and thoughtfulness and really vividly addressing, these intertwined aspects of engagement and rigor, as I think Bill or Chris mentioned, that, are vital to advance us in this area. And I think we really have an opportunity here to regain momentum in addressing childhood obesity. It won't be easy, as these talks highlighted, but the science has advanced incredibly, in the sense, the activities of the Obesity Roundtable and the whole and NCOR's whole history. So I think there's a tremendous opportunity here. And the third point that really jumped out at me is this mismatch between, how we support this kind of research and what the communities need and what the, change makers need to engage with communities and develop the programs and rigor needed to advance these complex and multiple interventions. So that's hopefully NIH and CDC and USDA and other major funders will keep hearing that message, and we can, do something about it. Next slide. I wanted to highlight a couple of resources just from NCOR's longtime supporter, and not to, everyone has great resources to highlight, but a couple of these are brand new and seemed useful. But first of all, in 2017, ODP had a Pathways to Prevention workshop, Methods for Evaluating Natural Experiments in Obesity, that touched on this broad theme of, interventions and policy systems and environment. And there's a paper summarizing it led by Karen Emmons. And I think it's fascinating to take a look at that in the context of this workshop and think about how we've made a lot of conceptual and scientific progress in the last 10 years. So that's incredible, but we have a long way to go in, really providing the whole of systems and policy systems and environment approach, the solid basis it needs to keep helping to move the policy needle. Then these resources, a little oriented towards randomized trials and cluster randomized and group trials. But when we can do those, they are powerful evidence. But I'm not showing these to say we have to do them. Just here's some good resources for that sort of thing. So I commend them to you. Links are in the chat box. Next slide. So we really look forward to seeing you tomorrow. I think I'm equally excited about tomorrow's lineup as I was about today's. Today delivered, and I know tomorrow will as well. We have a keynote address from Terry Wang at NYU, 2 amazing panels, Making an Impact at Last, Ensuring Local Relevance and Sustainability of PSE Interventions, so a clear theme of today as well, and Integrating Social Drivers into PSE Interventions. And then we'll wrap up tomorrow with our distinguished co-chairs, Shariki Kumanyika, Jamie Shariki, and Tamara Dubowitz, addressing where do we go next. So continuing to delve into this, let's lay out the steps that are needed to advance efforts to help create healthy, happy people and healthy, happy communities. That's our goal. Next slide. The workshop, if you haven't seen it or want to share it with friends, will be archived on the NCORE website. It'll take a week or two or so to get all the videos up. And next slide. And to receive an update once the workshop recording is available, sign up for our newsletter if you aren't already signed up. Number of people signed up is a vital metric for assessing the value of NCORE. And last slide. Thank you so much for participating, attending, planning, and engaging, and look forward to seeing you tomorrow.